Bismillahirrahmanirrahim. Quote of the day. The future belongs to those who believe in the beauty of their dreams. Today, the topic of my presentation is Introduction of Epidemiology. I'm presenting this topic under kind supervision of Professor Dr. Saira Afzal. Learning objectives. At the end of the session, participants will be able to discuss the historical evolution of epidemiology, definition of epidemiology, explain the usage of epidemiology, aims of epidemiology, basic epidemiological approach, terminologies used in epidemiology. First, we'll discuss the history from Hippocrates to John Snow, cholera 1854. So here's the cholera map. It's cholera 1854 investigation. That these are kind of like mentioned here. The map is also mentioned here. John Snow, pillar of epidemiology. On 31st August 1854, after several other outbreaks had already occurred elsewhere in the city, a major outbreak of cholera struck Soho. Dr. Snow later called it the most terrible outbreak of cholera which ever occurred in the kingdom. Over the next 3 days, 127 people on or near Board Street died. In the next week, 3/4 of the residents had fled the area. By 10 September, 500 people had died and the mortality rate was 12.8% in some parts of the city. By the end of the outbreak, 616 people died. John Snow and cholera. The miasmatic theory of disease held that diseases such as cholera, chlamydia, or the Black Death were caused by miasma, Greek language pollution, a noxious form of bad air. John Snow and cholera. This concept has been slanted by the germ theory of disease, also called the pathogenic theory of medicine. Is a theory that proposes that microorganisms are the causes of many diseases. Although highly controversial when first proposed, it is now a cornerstone of modern medicine and clinical microbiology, leading to such important innovations as antibiotics and hygienic practices. Introduction. Epidemiology is the basic science of preventive and social medicine. Epidemiology is derived from the word epidemic, epi among, demos people, logo study, which is a very old word dating back to 3rd century BC. Epidemiology has grown rapidly during the past 3 decades. It has now become firmly established in medical education. Epidemiology has been defined by John M. Last in 1988 as the study of the distribution and determinants of the health-related states or events in specific populations and the application of this study to control of health problems. Keywords. So the first word is distribution here. That is, according to the definition, the study of the distribution and determinants of health-related states of events in specified human populations and its application to the control of health problems. So distribution refers to time, place, and person here. Second keyword here is the determinants. So the study of distribution and determinants of health-related states or events in specified human populations and its application to the control of health problems. So determinants are basically it refers to cause and the risk factors. Keywords, the third keyword here is the populations. So the study of distribution and determinants of health-related states or events in specified human populations and its application to the control of the health problems. So populations refer to the public health. So the fourth keyword here is application, which refers to the information for action. Epidemiology is the distribution, which refers to person, place, and time. So basically, we kind of like categorize it to descriptive epidemiology, and determinants, which are agent, host, and environment. So basically, we kind of categorize it to the analytical epidemiology. So the distribution and determinants of disease and health events and health in human populations, and the application of this study to the control of health problems. That is the complete definition. So it's a triad of agent, host, and environment. Basic epidemiological approach. First, we have to observe, count cases, which are the events, describe time, place, person, calculate rates, compare rates, develop hypothesis. So this is basically the descriptive epidemiology. test hypothesis, implement actions, control, prevention. So this is the analytical epidemiology, this part. Concept of epidemiology. The concept of epidemiology encompasses three components. First one is the disease frequency, measurement of frequency of disease, disability, or death, and summarizing this information in the form of rates and ratios. For example, prevalence rate, incidence rate, death rate, etc. Thus, the basic measure of disease frequency is rates or ratio. The rates are essential for comparing disease frequency in different populations or subgroups of the same population in relation to suspected causal factors. Such comparisons may yield important clues to disease etiology. Epidemiology is also concerned with the measurement of health-related events and states in the community. For example, health needs, demands, activities, tasks, healthcare utilization, and variables such as blood pressure, serum cholesterol, height, weight, etc. Second is the distribution of disease. An important function of epidemiology is to study the distribution patterns in various subgroups of the population by time, place, and person. That is, the epidemiologist examines whether there has been an increase or decrease of disease over the time span, whether there is a higher concentration of disease in one geographic area than others, whether the disease occurs more often in men or in particular age group, and whether most characteristics or behavior of those affected are different from those are not affected. Determinants of disease. A unique feature of epidemiology is to test etiological hypotheses and identify the underlying causes or risk factors of disease. Aims of epidemiology. According to International Epidemiological Association, epidemiology has three main aims. First one is to describe the distribution and magnitude of health and disease problems in human populations, descriptive studies. Second one is to identify etiological factors, risk factors in the pathogenesis of disease, and analytical studies. Third one is to provide the data essential to planning, implementation, and evaluation of services for the prevention, control, and treatment of disease, and to setting up of priorities among those services. The ultimate aim of epidemiology is to lead to effective action. First one is to eliminate or reduce the health problems or its consequences, and to promote the health and well-being of society as a whole. Uses of epidemiology. Morris has identified 7 distinct uses of epidemiology. These are: first one, to study historically the rise and fall of disease in the population. Second, community diagnosis. Third, planning and evaluation. Fourth, evaluation of individual risks and chances. Fifth is completing the natural history of disease. Sixth, searching for causes and risk factors. To study historically the rise and fall of disease in the population. It is well known that the health and disease pattern in a community is never constant. There are fluctuations both over short and long periods of time. Epidemiology provides a means to study disease profiles and time trends in human population. By a study of these trends, we can make useful projections into the future and identify emerging health problems and their correlates. Community diagnosis. One of the uses of epidemiology is community diagnosis. Community diagnosis generally refers to the identification and quantification of health problems in a community in terms of mortality and morbidity rates and ratios. It helps to identify individuals or groups at risk or those who are in need of healthcare. Planning and evaluation. Epidemiological information about the distribution of health problems over a period of time and place provides the fundamental basis for planning and developing the needed health services and for assessing the impact of these services on the people's problems. Evaluation is an equally important concern of epidemiology. Any measures taken to control or prevent a disease must be followed by an evaluation to find out whether the measures undertaken are effective in reducing the frequency of the disease. Evaluation of individuals' risks and chances. One of the most important tasks of epidemiologists is to make a statement about the degree of risk in a population. Completing the natural history of disease. Epidemiology is concerned with the entire spectrum of disease in the population. The epidemiologist, by studying disease patterns in the community in relation to agent, host, and environmental factors, is in a better position to fill up the gaps in the natural history of disease than a clinician. Searching for causes and risk factors. Epidemiology helps to identify the cause and the risk factors of diseases. Terminology is used in epidemiology. Infection, the entry and development or multiplication of an infectious agent in the body of man or animals. Contamination, the presence of an infectious agent on a body surface, also on or in clothes, beddings, toys, surgical instruments, or dressings, or substances including water, milk, and food. Infestation, infested articles or premises are those which harbor or give shelter to animal forms, especially arthropods and rodents. Host, a person or other animal, including birds and arthropods, that affords subsistence or lodgement to an infectious agent under natural conditions. Infectious disease, a clinically manifest disease of man or animals resulting from an infection. Contagious disease, a disease that is transmitted through contact, example, scabies, trachoma, leprosy, STD. Communicable disease, an illness due to a specific infectious agent or its toxic products capable of being directly or indirectly transmitted from man to man, animal to animal, or from the environment, air, dust, soil, water, food to man or animal. Epidemic, a widespread occurrence of an infectious disease in a community at a particular time. Endemic, it refers to the constant presence of a disease or infectious agent within a given geographic area or population group without importation from outside. May also refer to the usual or expected frequency of the disease within such area or population group. For example, common cold is endemic because somebody always has one. This is the epidemic pattern. Sporadic. The word sporadic means scattered about. The cases occur irregularly, haphazardly from time to time, and generally infrequently. The cases are few and separated widely in space and time, that they show little or no connection with each other, nor a recognizable common source of infection. For example, polio, tetanus, herpes zoster. Pandemic, an epidemic usually affecting a large population of the proportion of the population, occurring over a wide geographic area, such as a section of a nation, the entire nation, a continent, or the world. For example, influenza pandemics of 1918 and 1957. Here are some patterns of endemic pattern and the sporadic pattern. Exotic, diseases which are imported into the country in which they do not otherwise occur, as for example, rabies in UK. Zoonosis, an infection or infectious disease transmissible under natural conditions from vertebrate animals to man, may be enzootic or epizootic, for example, rabies plague, bovine tuberculosis, anthrax, brucellosis, salmonellosis, etc. Epizootic, an outbreak epidemic of disease in an animal population, for example, anthrax, influenza, rabies. Apornithic, an outbreak epidemic of disease in a bird population. Enzootic, an endemic occurring in animals, for example, anthrax, rabies. Nosocomial infection. Nosocomial infection is an infection originating in a patient while in a hospital or other health care facility. It denotes new disorder associated with being in a hospital. Opportunistic infection. This infection by an organism that takes the opportunity provided by a defect in host defense to infect the host and hence cause disease. The organisms include herpes simplex cytomegalovirus. Iatrogenic infection. Any untoward or adverse consequence of a preventive, diagnostic, or therapeutic regimen or procedure that causes handicap, disability, or death resulting from a physician's professional activity or from the professional activity of other health professionals. Surveillance. Surveillance has been defined as the continuous scrutiny of the factors that determine the occurrence of and distribution of disease and other conditions of ill health. Eradication. Termination of all transmission of infection by extermination of the infectious agent through surveillance and containment. Eradication is an absolute process, an all or none phenomenon. Restricted to termination of an infection from the whole world, it implies the disease will no longer occur in a population. Epidemiology and prevention. Types of prevention: primary, secondary, and tertiary. Definition of primary is preventing the initial development of a disease. Example is immunization, reducing exposure to a risk factor. Secondary prevention, early detection of the existing disease to reduce severity and complications. For example, screening for cancer. Tertiary prevention, reducing the impact of disease. For example, rehabilitation for stroke. Here are some recent advances. Epidemiological trends of mosquito-borne viral disease in Pakistan. Globally, arboviruses are public health problems. Pakistan has seen a fast-paced increase in mosquito-borne flavivirus diseases, such as dengue because of deforestation, climate change, urbanization, poor sanitation, and natural disasters. The magnitude and distribution of these diseases are poorly understood due to lack of competitive nationwide surveillance system. In dengue epidemic countries, the recent epidemics of chikungunya and human nest wild virus have created panic among the public and are thought to provoke an outbreak of Zika virus in Pakistan. Recently, hospital-based surveillance has indicated the presence of Japanese encephalitis virus, which is deeply concerned by developing countries such as Pakistan. The situation could become more devastating because of poorly developed diagnostic infrastructure. To date, no licensed vaccine has been used in Pakistan, and preventive measures are mainly based on vector control. This review provides comprehensive information concerning the association of risk factors with disease occurrence, epidemiological trend, and prediction of the spread of mosquito-borne diseases, attention to new threats of Zika virus, and future perspectives by benchmarking global health policies. Here's another recent advance, concurrent dengue infections epidemiology and clinical implications. Multiple dengue virus serotypes circulating in a geographical area most often led to simultaneous infection of two or more serotypes in a single individual. The occurrence of such concurrent infections ranges from 2.5 to 30%, reaching as high as 40 to 50% in certain dengue hyperendemic areas. Concurrent dengue manifests itself differently than mono-infected patients, and it becomes even more important to understand the effects of co-infecting serotypes in concurrent infections to ascertain the clinical outcomes of the disease progression and transmission. In addition, there have also been reports of concurrent multiple dengue virus infections in the presence of other arboviral infections. In this review, we provide a comprehensive breakdown of concurrent dengue infections globally. Furthermore, this review also touches upon the clinical presentation during those concurrent infections categorized as mild or severe forms of disease presentations. Another aspect of this review was aimed at providing insight into the concurrent dengue incidences in the presence of other arboviruses. Viral infections, Pakistan, prevalence factors affecting spread and recommendations for control. Pakistan is endemic to a number of viral infections owing to its humid climate, topographical variation, soaring population, and lack of education and awareness. These viruses may have several different modes of transmission, including respiratory or airborne transmissions, sexual transmission, bloodborne, fecal-oral transmission, vector-borne transmission, and transmission following an organ transplant. Although several different microorganisms are responsible for causing these infections, a few viruses are found more commonly in Pakistan and are primarily responsible for causing infections. In this study, we present a review of the most recent studies on different viruses transmitted through various transmission routes found commonly in Pakistan, along with prevalence of each, and recommend control measures required against these viruses. Updated epidemiology of hepatitis C virus infections and implications for hepatitis C virus elimination in Germany. In 2014, analysis was conducted to evaluate the hepatitis C virus epidemiology and disease burden in Germany. Since then, there have been considerable development in hepatitis C virus management, such as in the implementation of direct-acting antivirals. The aims of this analysis was to assess the recent data available in Germany, establish an updated 2020 hepatitis C virus prevalence and cascade of care, and evaluate the impact of what-if scenarios on the future burden of disease using modeling analysis. A dynamic Markov model was used to forecast the hepatitis C virus disease burden in Germany. Model inputs were retrieved through literature review, unpublished sources, and expert input. Next, what-if scenarios were developed to evaluate the status of the COVID-19 pandemic and steps needed to achieve the WHO targets for elimination. At the beginning of 2020, there were 189,000 viremic infections in Germany, a decline of more than 85,000 viremic infections since 2012. Annual treatment starts went down since 2015. Compared with 2019, the COVID-19 pandemic resulted in a further 11% decline in 2020. If this continues for 2 years, it could result in 110 excess hepatitis C virus cases and 2,200 excess liver-related deaths by 2030. To achieve the WHO targets, 81,200 people need to be diagnosed with 1,18,600 initiated on treatment by 2030. This could also avoid 1,020 deaths and 720 hepatitis C virus cases between 2021 and 2030. Germany has made strides towards hepatitis C virus elimination, but more efforts are needed to achieve the WHO targets by 2030. No time for MCQs. First one. In the definition of epidemiology, determinants generally includes all except A, agents, B, causes, C, control measures, D, risk factors, E, sources. Anyone?
C.
Yeah, it's C. Basically, determinants, they refer to agent, causes, risk factors, and sources, except the control measures. In the definition of epidemiology, distribution refers to all except A, who, B, when, C, where, D, why, E, both A and B. So, anyone?
D.
Yeah, it's D. Who, when, where is basically, it comes in the domain of distribution. Third one, epidemiology as defined would not include which of the following activities? A, describing the demographic characteristics of an affected population. B, determinants, including the study of possible risk factors. C, application to control health problems. D, prescribing the actual treatment of individuals. E, to promote the health and well-being of society as a whole.
D.
It's D. We cannot, the epidemiology would not actually give the treatment of the individuals. Number 4, a number of passengers on a cruise ship from Puerto Rico to Panama Canal have developed a gastrointestinal illness compatible with norovirus, formerly called Norwalk-like virus. Testing for norovirus is not readily available any nearby island, and the test takes several days even where are available. Assuming you are the epidemiologist called onto board the ship and investigate this possible outbreak, your case definition should include at a minimum A, clinical criteria plus specification of time, place, and person. B, clinical features plus the exposures you must suspect. C, suspect cases. D, the nationally agreed standard case definition for disease reporting. E, none. Anyone?
A.
It's A. Yes, it's clinical criteria plus specification of time, place, and person. So, A. Number 5. A patient came in emergency with signs of dehydration and severe diarrhea. An intravenous infusion was given to correct electrolytes and fluid levels. He was discharged after 2 days. About 2 months later, the patient came back with signs of jaundice and hepatitis B surface antigen was positive. He did not give history of any event which could have led to this disease. This hepatitis infection was maybe labeled as A, subclinical, B, opportunistic, C, idiopathic, D, cross infection, E, iatrogenic.
E.
Yes, it's E,
D.
iatrogenic. Number 6, after excision of breast for carcinoma of breast, surgical reconstruction of breast tissue was done. This reflects A, primary prevention, B, secondary prevention, C, tertiary prevention, D, medical treatment, E, surgical treatment. Anyone?
C.
No, it's B. It's secondary prevention. Seventh, infectious diseases such as dengue, tuberculosis, malaria, typhoid, influenza are common in Pakistan due to overcrowded population and poor healthcare infrastructure. Diseases that are always present in a community, usually at a low, more or less constant frequency, are classified as having an dash pattern. A, epidemic, B, endemic, C, pandemic, D, seasonal trend, E, none.
Endemic.
Yeah, that's endemic. B. 8th, Acute hemorrhagic conjunctivitis affected a large proportion of population over a wide geographic area in 1971 and 1981. An epidemic that becomes unusually widespread and even global in its reach is referred to as A, pandemic, B, hyperendemic, C, sporadic, D, seasonal trend, E, secular trend.
A,
Anyone?
pandemic.
Yeah, it's A, pandemic. Ninth, a pap smear and colposcopic examination for the early detection of cervical cancer and papilloma virus infection constitute A, primary prevention, B, secondary prevention, C, tertiary prevention, D, primordial prevention, E, medical treatment.
A,
No, it's not A. It's B, it's the secondary prevention. Number 10, an outbreak of brucellosis in cattle is reported threatening the health of human population. This outbreak is A, epizootic, B, epornithic, C, enzootic, D, exotic, E, epidemic.
E.
It's A, epizootic. Here's the key. And thank you so much.
Thank you so much, Dr. Amna.
Thank you so much, everyone. Thank you so much.
Enough.